Does freedom of speech matter to you? I don't just mean in terms of civilization, but even specifically, does freedom of speech matter to your health? Well, my next guest does.
A clear path forward requires looking back and learning. Good public policy requires human connection. It's a consideration of the facts, applying common sense, and innovation. It's urban, it's rural, it's real life. We all have something to contribute. We all have a responsibility to get informed because there's a little piece of Canada in all of us, isn't there? Let's learn on this path together. This is Leaders on the Frontier.
So my next guest is none other than Dr. Jay Bhattacharya, and Jay is an incredible leader, as we've had common sense to bear as a physician, an epidemiologist, a public policy health expert, and also one of the co-authors in October 2020 of the Great Barrington Declaration, along with Dr. Martin Kulldorff from Harvard and also Dr. Sunita Gupta from Oxford. So Jay comes from us from Stanford University, and welcome, Jay.
Thank you. So good to be here, David. Thank you for inviting me.
Well, it's a pleasure, and we're so glad we can continue our conversations over the last while on so many fronts. And there's so many bombshells that seem to be going off that kind of, as they click off, they bring more clarity to what's happened the last 3 years, and it's really quite stunning. But so I'm really excited about going through those, and you can help us understand what's your perspective. So I did want to look at a little bit of a basic introduction here for people that may not be familiar with you, because you have a kind of a worldwide following now with your other co-authors of the Great Barrington Declaration. But I do want to ask you, why did you write the Great Barrington Declaration? Can you summarize for people what the significance of that is?
Sure. So the Great Barrington Declaration basically argued in a one-page, very, very easy to read document that the lockdowns that we had been following we wrote it in October 2020, that the lockdowns we'd followed in the spring of 2020 and that were obviously coming in later in 2020 as the winter wore on, that they were a tremendous mistake that had harmed the poor, the vulnerable, the working class people, that they had that they were ineffective at protecting vulnerable older people from COVID itself. And so we call the Great Barrington Declaration called for focused protection of vulnerable older people and lifting of lockdowns, based on the scientific evidence that at the time it was clear to us that was the right strategy.
Okay, so you basically emphasized, dare I say, best practices when it came to public health policy. Is that right, Jay?
That was our goal. I mean, I think, David, the thing is, if you look at the Great Barrington Declaration, it's not actually all that original a document. I mean, I like it. It's I think it's quite important. Probably my favorite thing I've ever been involved with. But it essentially outlined the old pandemic strategy that we'd followed for a century of respiratory virus pandemics. We wanted to shatter the illusion that had been that was prevalent, that lockdowns were a scientific consensus. We wanted to tell people that legitimate scientists were in opposition to the lockdown strategy, and that there was an alternate strategy, focused protection of vulnerable people, that was available, that would have protected human life better.
Exactly. So they kept bleating out, these health authorities and others, that we're following the science, and there's a consensus on this. There's no debate about this, but that was just utter tripe, wasn't it?
It was. A lot of scientists had difficulties and problems with the lockdown strategy. The lockdown strategy was an enormous scientific experiment, unprecedented in history, to lock down the societies of the world at scale for such a long time. And it was very clear to us in October 2020, when we wrote the declaration, that the lockdowns were coming back, that they failed to stop COVID from spreading in spring of 2020, that they'd caused tremendous damage, especially to the poor of the world, especially to children, and that the same strategy to push lockdowns in the world, to pretend as if there was no scientific opposition to them, was going to be used again to push lockdowns. And so that is the reason, the primary motivation for writing the Great Barrington Declaration.
Indeed. So well done and bravo. And, certainly in retrospect, you were right. I mean, there's no question, and the facts prove it. So, for those who have not read the Great Barrington Declaration, be sure to read it. I think some millions have. So it's worth looking at for sure. So this has continued to be, as we wind up 2023 and get into 24, a year of bombshells. And I want to begin with, in the Canadian context, and that is the National Citizens Inquiry tabled their massive report on November the 28th. Certainly made history as they did a coast-to-coast tour of hearing hundreds of witnesses, including expert witnesses, including yourself, on really the findings and the impacts of COVID-19 management on Canadians. And it was really quite a revelation, very moving. And one of the things that they emphasize in the report is the so-called admissions of facts that have really come out. And I'd really appreciate your help in trying to understand this. So one of them has to do with the so-called health and effectiveness of the vaccines. And one of the things that has come out, and Health Canada admits this, is that the vaccines themselves are adulterated. They have contaminants in them of DNA, no less. So why would DNA be in vaccines? Help us understand this. You understand the manufacturing of this and how they scaled up on these things. But should that be a concern to people, that revelation?
Okay, so this is a fact that's come out just in the last few months. There was a scientist named Kevin McKiernan who he's a bona fide expert in DNA sequencing. In fact, he was part of the Human Genome, a very important person in the Human Genome Project, and led the marijuana genome sequencing project. So he has a lot of expertise in DNA sequencing and molecular biology. He had some vials of the Pfizer vaccine left over. And he decided he was just gonna. I guess this is how scientists work. Sometimes you have an inspiration, you say, okay, let's just play around. So he tried to see if there was DNA in the Pfizer vaccine vials that were left over that he had available to him. Now, why would there be DNA? There really shouldn't be DNA in these vials. This is an mRNA vaccine. It's an mRNA product encased in a lipid nanoparticle, which is essentially just think of it as like a little sphere that encases the mRNA, which then delivers the mRNA to the cells, that then causes your cells to produce the antigens that then your body reacts to, that causes the immune reaction that produces immunity. That's the whole sequence. Nowhere in that sequence is DNA. It's all, and the reason is partly because the mRNA is supposed to be degraded rapidly. It's not, your body isn't supposed to keep producing the spike proteins. It's just supposed to produce it and then essentially be degraded and be gone. DNA has the potential to last longer. There's lots of reasons that you wouldn't necessarily want DNA in these vaccines. So now when Kevin played with these vials, he found DNA there. And I remember he contacted me, told me this was resolved, and I was really surprised by it. But I was waiting to see if there was going to be replication of the result. Mm-hmm. And a couple months later, a professor in South Carolina, Philip Buchholz, found exactly the same thing independently of McKiernan. He found DNA in the vials that he had left available to him.
And to be clear, replication is obviously critical in terms of confirming the science behind this.
Yeah, and then later, I think Health Canada found the same exact result, DNA in the vials. So this is not like a conspiracy theory. This is essentially like a now replicated scientific result. So the question is why? How did it get there? And the answer is really it's a little bit technical, but it's important so that people understand exactly what happened, especially if they're worried or if they took the vaccines. So when Pfizer ran the randomized trials for the vaccines, they used a process to produce the mRNAs that was very, very clean. It didn't involve any DNA at all. And so most of the people, in fact, everyone in the trials that got the vaccine with this clean process. They called it Process 1, that produced an mRNA snippet that's specific for producing the snippets of the spike protein that they wanted for the production of this vaccine. And so the people in the randomized trials were evaluated based on a process that didn't have any DNA contamination in it. Now, there were about 40,000 people in the trial. The process of making the vaccine when you are doing it with this clean process is expensive and slow, and it's fine, I guess, when you make it for 40,000 people. But then when you send the vaccine to billions of people, you can no longer just use that slow process. You
Hmm.
need a different process to produce the vaccine. Ideally, you want a vaccine that's bioequivalent to the process we used in the trial, right?
Hmm.
So what Pfizer did was they used a process that's actually often used for for producing, for instance, human insulin at scale. They took bacteria, inserted something called a DNA plasmid. A DNA plasmid is like a circular piece of DNA
Hmm.
that bacteria uptake. And then the bacteria just turn into little factories that'll produce whatever the DNA plasmid tells it to produce. And so that's what it did. So they inserted a DNA. Pfizer took some DNA plasmid, put it into bacteria, fed the bacteria. Then the bacteria then produced the mRNA product, and then they purified the mRNA product out of this bacterial slurry, and then that's what was sent to people worldwide. That's what was injected to people worldwide. The products of this bacterial process, manufacturing process. The problem is that the DNA plasmid that they used to instruct the bacteria about what they wanted the bacteria to make, this mRNA product, that stayed contaminated in the vials. That's the DNA that they were finding. There was this bacterial plasmid used to produce and manufacture the vaccine at scale.
Wow.
And
So,
that was,
just to be clear then, so the initial approval process was a quote clean process. And then when they went to the large numbers, they scaled up. They used obviously a different process and they came out with arguably a different product. Is
yeah,
that a
I mean,
fair comment?
that is absolutely a fair comment, right? So I think one of the things that, if I understood the Health Canada report correctly, is that Pfizer, in its reports to Health Canada, in order to gain initial approval, made it very difficult to find. I think they did actually reveal that they used this other process, but they made it very difficult to find what was in the DNA plasmid. And the reports, they didn't do a sufficient job, essentially documenting that they had removed the vaccines of this contaminant, right there. And in fact, one of the results I've seen from Buchholz and McKernan, and is that the level of DNA contamination is higher than you would the normal safety levels for other similar products
Hmm.
would allow. I'd say one other thing, like those normal safety levels are set based on DNA being in a product. Those are set based on not on vaccines that have a vehicle to deliver the vaccine into cells, this
Hmm.
lipid nanoparticle. They're
Yeah.
just based on when you eat meat or you eat vegetables, you're eating DNA. There's nothing like magical about that. Your
Hmm.
body knows how to process it. But what we don't know is if you have this DNA plasmid inside a lipid nanoparticle that is designed to be delivered essentially into the cells, into cell cytoplasm, and potentially even into nuclei, what will that do?
Hmm.
What will that accomplish? Now, so you asked me at the beginning, what are the health consequences? And I have to say the answer is I don't know. I don't know the answer to that because no one's ever studied this before.
But to be clear, no one's ever studied this. And the question is, why the heck are these vaccines being promoted for public consumption into your body? I mean, surely they should be pulled off the shelves. I mean, is this not a kind of a, dare I say, a bait and switch?
I mean, I think, well, so from one, like the vaccine vials they were testing on are no longer on the market. Those are from the original vaccines that were out in 2021. So the question is whether there's still DNA contamination. I think that's an open question for the new vaccine, the
Hmm.
new booster vaccines. I don't know the answer to that question. I don't know. I think it's unlikely that they're causing huge amounts of health problems at scale, but you can tell biological or molecular biological stories about how this vaccine, the DNA contamination, can lead to severe health problems. It's not. I think it's very likely going to be rare if they do, but who knows? At the very least, these are questions that our regulators should have asked Pfizer to answer before recommending the vaccine at scale.
Indeed. So this is where this is not over. We need to ask these incisive questions for the sake of people's health and of course, safety. So that is a very significant revelation. And then that moves us into another area, which was the state of Texas just came out with a massive lawsuit against Pfizer. And in the release it says Pfizer engaged in false, deceptive, and misleading acts and practices by making unsupported claims regarding the company's COVID-19 vaccines in violation of the Texas Deceptive Trade Practices Act. So it's fascinating. They're going after Pfizer, the large drug juggernaut, that is really calling them out on product effectiveness. Is that a surprise to you?
No, it's not a surprise. I mean, the only question is whether it's Pfizer or the governments that essentially indemnified Pfizer to primarily blame. I guess it'd be funny for the state of Texas to sue the FDA, but in principle they could. I think, I think, or the NIAID or something. The issue is, I think, the overstatement of the efficacy of the vaccine is very clear. I think in 2021, I remember Albert Bourla, the CEO of Pfizer, giving, essentially interviews where he would claim that the vaccine stopped you from getting COVID. The evidence in the trials didn't justify that. The evidence in the trials looked at prevention of symptomatic infection, but didn't look at prevention of all infection. And in fact, it's possible to get COVID and have a very few symptoms or no symptoms, right? It didn't look at whether it stopped disease transmission. In other words, the randomized trials in 2020 did not justify the claims that Albert Bourla was making about the vaccines in 2020.
Indeed. Yeah. So stay tuned on that lawsuit, because an interesting thing to that Texas lawsuit is that it also accuses Pfizer, if I understand it correctly, of basically working to help censor the truth regarding the efficacy of those vaccines. So this is a big one. So that's significant. And I think the next one is a very interesting case, and that has to do with the First Amendment, freedom of speech again. And this relates to the lawsuit Missouri versus Biden, as in the president, Joe Biden. And this is just a big one where the case, and you were involved in this, and I want to get to that in a moment, Jay. This case has uncovered astonishing evidence of a team of censors in the U.S., and this has big implications for Canada, that would make, frankly, communist China almost blush, I suspect, because it involves 67 agencies really strong-arming every area of the tech sector on social media. And I think the judge even said this is like 1984. And I encourage people to read the judgment because this just says, wow, this is obviously censorship in full action. So how were you involved in this case, Jay? It's a fascinating one.
So I'm a plaintiff in the case, actually, David. So the Missouri and Louisiana Attorney General's office brought the case in August of 2022 against the Biden administration. The allegation was exactly as you said, that the Biden administration had set up a process to censor ideas and people online, especially ideas and people that criticized Biden administration priorities regarding COVID. And the judge in the case, it was brought in a federal district court in Louisiana. The judge in the case, looking at the evidentiary record, essentially said, actually wrote that in the conclusion to the decision that the Biden administration has set up something like a ministry of truth, an Orwellian ministry of truth. The discovery in the case, what we found is that agencies like the CDC, the Surgeon General's office, even the FBI, and the White House itself would go to social media companies and tell them, here's a list of people and ideas to censor. And not just censor in terms of like remove off the platform, but also deboost, make sure that do all kinds of like crazy shenanigans to
Just
make sure
stunning.
that right. And it's just an obvious violation of the American First Amendment. And they would back it up with implied threats of, well, if you don't stop, if you don't censor along the lines that we want you to censor, we're going to go after you. We're going to go after you with our regulatory power.
Yeah,
And
this
it's
is like
so-
right out of the Soviet Union, and they knew what they were promoting was not accurate. It was not factual. It was all political. It's stunning, isn't it?
I mean, it didn't matter if you were telling the truth or not, right? So if you could point to scientific studies, peer-reviewed scientific studies, and you could still get censored if it went against the
Hmm.
priorities of the White House. There's this really interesting, really funny thing that happened in we found in one of the discovery documents. April of 2021, the Johnson & Johnson vaccine, the CDC said that the Johnson & Johnson vaccine needed to be paused because they'd found a signal for strokes in women. I don't know if you remember this incident.
Yeah,
It was a big deal because the CDC, that
I
was the
do.
first time like the vaccine uptake sort of slowed up. The White House had been pressuring Facebook to put into its algorithms to tag anyone that claimed that there were any vaccine injuries at all.
Hmm.
Even true vaccine injuries, like the patient groups would pop up saying we have vaccine injuries, and Facebook would suppress them because the White House told them they had to suppress them, even if they're true. When the CDC put a pause on the J&J vaccine, the White House shared the CDC announcement on its Facebook page.
Hmm.
The algorithms that the White House itself had induced Facebook to put in place tagged the White House Facebook page as an anti-vax group, because they had shared the CDC's announcement that it ought to be paused, the J&J vaccine ought to be paused.
Wow.
And then you have this like series of emails from Rob Flaherty, who was a staffer inside the White, like a major figure inside the White House, yelling at Facebook saying, "Why are you treating us as if we're anti-vax? Why has our page stopped growing?" And so they got special treatment, unlike everybody else. They got to continue being an anti-vax group, whereas the rest of the people sharing vaccine injuries didn't get that same kind of favor.
It really is stunning, and I think people probably underestimated the amount of power that those government officials behind the scenes had over those tech companies, because obviously they all make their money, their livelihoods through their licensing. And so if those licenses are put in jeopardy, they're done. And I think that power was wielded to pull every political narrative that they wanted. It wasn't just COVID-19 now. It's just like an octopus, isn't it, Jay?
Yeah, I mean, they used it to suppress the speech of their political adversaries, and that is just a straightforward First Amendment violation. But I can almost understand that. That's just raw politics and
Yeah,
power. It's unconstitutional and
right.
terrible and should not be done. But you can kind of understand it. But then to use it to suppress scientific debate and discussion,
Wow.
I mean, what reasoning could there possibly be for that? And I think I think the American people, the Canadian people, once they start to see what happened, the manipulation
Hmm.
of the information environment by this censorship that led to tremendously bad and harmful decisions that may have caused, I think censorship caused a tremendous number of deaths, if you ask me,
Indeed.
because if you think about it, a lot of the policies that were tremendously damaging, the lockdown policies, the
Hmm.
school closures, they were all put in place on the premise that all scientists agreed that they needed to have them.
Exactly. Yeah, the public was there drinking in all this information, all on the assumption that what was being told, there was what was it again? Oh, yes, a consensus, when in fact there was a raging debate that was being stifled by these crazy censors. And yeah, all out of power and money and God knows what else. But in this context, I think sometimes people would not realize that this censorship was across the board, in terms of all media, like in terms of mainstream media as well. They were all the documents are all coming out proving that kind of coordination. It's really kind of hard to believe. But in this context, it's across the Western world. And this is why some people may ask, well, why is this relevant to Canadians? Because so many Canadians get their information through social media, the usual suspects of mainstream media driven out of the United States. And this has really been a phenomenon that really had worldwide implications, did it not?
It absolutely did. I mean, I can tell you from my colleagues in Canada that it wasn't just the American government that was involved in this kind of
Hmm.
propaganda and censorship efforts. I mean, I think it was very difficult for Canadians also to
Indeed.
speak. The information environment in Canada, if anything, was even more constrained than it was in the United States.
Hmm.
The idea that I think I mean I was surprised to realize how few Canadians had heard of the Great Barrington Declaration.
Indeed.
Essentially, the mainstream Canadian press, like the CBC, they actually straight up defame me, Martin, and Sinatra, accusing us of wanting to let the virus rip
Hmm.
right after we wrote the declaration, and wouldn't let us respond.
Yeah.
I mean, they're supposed to be neutral, but they were not. And then after that, there was silence about it, right? So the Canadian people were subject to an information environment that misled them about the science of the pandemic, the efficacy of the vaccines, the necessity for vaccine mandates, a whole host of the efficacy of masking, a whole host of scientific issues that were hotly debated
Hmm.
in the scientific community, but within the information environment permitted by the Canadian government, essentially withheld those facts were withheld from the Canadian people.
Indeed. So it's it just strikes me as an utter tragedy for people, any population, to be kept in kind of an information bubble where they do not know the basic debates, the truth, and that kind of healthy discussion is so vital. So this is again another revelation. I think in the Canadian context is quite unnerving. We just had another financial update and budget where additional monies now are being spent on the media. Some 2,000 media outlets receive significant media funding. And so, again, it begs the issue, to what extent is the media really serving the public with this kind of information? So it's a big challenge. But I think in itself, this kind of case is very significant. The Missouri case that you are a plaintiff in. And what's fascinating is that this is now being appealed by the Biden administration to the U.S. Supreme Court. So tell us more about the timing around that, and what do you think is going to happen?
Uh, okay, so just briefly, the original case was brought in August of 2022. On July 4th, 2023, we had the district court, the lower court, the federal court, ruled in our favor and ordered the Biden administration in a preliminary injunction to stop forcing social media to censor ideas and people.
A huge victory.
I was so pleased. I mean, I wrote a pretty triumphant. I mean, I probably jumped the gun on how triumphant it was, kind of piece
Hmm.
about it. But I was very pleased because it's like it's the restoration of First Amendment and free speech rights in a major country is a big deal. Um, and then the Biden administration appealed to an appeals court in Louisiana in the Fifth Circuit court, which then had a three-judge panel that ruled in our favor. All three judges saying exactly the same things. Now they narrowed the range of the preliminary injunction. So the original circuit court, the original district court, what it found was that what they ordered in the preliminary injunction was the Biden administration can't order censorship, and also they can't go to private entities and to generate a list for essentially to launder the censorship efforts off to private entities
Hmm.
and generate a hit list of censorship. The appeals court said that the Biden administration is not allowed to do the first thing. They're not allowed to go to the social media companies and threaten them for censoring, but they are allowed to like engage with public, like entities and nonprofit entities to try to look for misinformation.
Hmm.
That's permitted, but the first is not. Um, the Biden administration appealed to the Supreme Court, and the Supreme Court is now going to hear the case, which is a big deal in and of itself. The Supreme Court doesn't grant cert, I guess, is what the lawyers say. You know more than me, David.
Right.
Um, grant cert to very many cases, but they have agreed to hear our case, and we should hear it sometime. They should be hearing it sometime in the late winter, early spring. That will be a big indicator, because if the Supreme Court rules in our favor, then it's very likely we will win the case itself, which will go back down to the lower court and hopefully we'll have a preliminary injunction in place that will force this Biden administration to stop violating the First Amendment.
Indeed. So this is a big deal, and there's been some significant victories here. The cases are a bit nuanced, but I know it's hard to know what the U.S. Supreme Court will do, but based on certainly the precedents I've seen, from my humble opinion, I think that we have reason to be optimistic. So stay tuned, and Godspeed as you go to the U.S. Supreme Court on that one, Jay.
Thank you.
So we do have, another set of bombshells. We've all heard about the Twitter files when Elon Musk acquired Twitter, really a crime scene. And he had a whole cadre, a team of crack journalists swarm on those files to bring some investigative journalism to bear to find out what was really going on. And again, that was really quite profound. And then would you believe it wasn't enough for people like Matt Taibbi and Michael Schellenberger to get in there and find out yet another second revelation just recently. And this had to do with really confirmation, I think, of a whole different level of censorship again. So we've kind of had a bit of gray drip-by-drip revelations through the Twitter files that there's censorship going on. But this is something else. This shows that there was actually a real agency the last several years whose concerted mission, job priority number one, if you say, that was all about censorship on a whole host of issues. So it's almost like the image is becoming clearer and clearer. So Jay, you've been, again, involved in that revelation. So can you help us explain what's really going on there?
Yeah, so I mean, it's the situation is complicated, but I think I can try to simplify it. So first, the censorship effort predated the pandemic.
Mm-hmm.
That there were groups, some associated with military, like the U.S. military and others, that formed to try to control conversations online on the premise that foreign actors were trying to propagandize people. Mm-hmm. through now these actors were at first, I think, private, but very quickly they engaged with actors inside the U.S. federal government, like the State Department and others. And when 2020 hit, they shifted to control of speech over COVID. Speech about COVID, and also over the elections in the United States. Mm-hmm. And they essentially formed what I would call a public-private partnership aimed at censorship, engaging vast numbers of people, both inside the government and out, to try to control the speech of people online and elsewhere.
We also have an interesting twist to it as well. It's not surprising because its backbone is the Intelligence Defense Network. But that is also the Five Eyes Agreement, which relates to Canada, New Zealand, the UK, and of course Australia. So the implications are not totally clear in this, but what is clear is we have a lot of agencies in our governments that their job, they see it as censorship. It's not about enabling information. It's not about enabling, dare I say, democracy. It's something else. And I mean, this, for me, is, again, another revelation that we've got a huge problem as we look at our societies and our needs to renew them.
Yeah, I mean, I think the cooperation among Canada, Australia, the UK, the US on this is truly shocking. And what it means then is that I mean, it's the kind of propaganda activities that might once have been used against foreign adversaries, but instead this apparatus to control how people think based on control the information environment that people are bathed in, that has been deployed against the peoples of the free world. Mm-hmm. By the governments of the once upon a time free world, I should say. The picture is still muddy to me. I mean, I think the revelations are truly shocking, but they're not. But the picture hasn't yet come into focus. But what we have seen, what's very clear, is that entities that ought to have been working to safeguard free conversation, free speech. Instead, use their power over media, over social media, over governments, to try to use that power to suppress speech of political opponents and scientific opponents online in order to get their way on policies that they otherwise never would have had a chance to get had they allowed normal processes and civil rights to operate.
Well said. And it is truly a frightening paradox that you had government actors instructively and knowingly censoring and blocking the vigorous debate that needs to be happening about vital issues on every topic imaginable, from elections to all kinds of policy issues, and including health and the management of COVID-19. In that environment, without open and free discussion, you are no longer able to engage science in the search for truth.
If you think that a pandemic, an emergency, is the right time to censor, you're essentially, what you're saying is that in the most complicated situations where there's the most uncertainty, we should reduce the number of brains thinking about a topic. It's exactly backwards, David. Especially when during an emergency, you need to have the most free speech. That is how you get to the best results, because there really isn't a godlike power in someone like Tony Fauci, for instance, who embodies science and then therefore can distinguish true from false unerringly. No one like that exists. And essentially the premise of this censorship power is that, oh, well, if we know what's true, we just have to stop all these crazy people online like, Jay, Martin, and Sinatra from spreading their message, and then we can get our way. Mm-hmm. Well, the problem is the premise to begin with. Like, there is no monopoly on the truth held by people like Tony Fauci. Indeed. There needs to be on a discussion, vigorous discussion. That's how you get at the truth. No one is right all the time. And it's by that debate and discussion that you inch toward the truth. That was always the wisdom and the genius of the free world, was to permit that to happen, even during the most difficult times, especially during the most difficult times. And during the pandemic, most of the free world decided to go the other way.
Indeed. And I just commend you and Martin and Sunita Gupta for speaking up profoundly about this issue, among so many others in Canada and around the world who were frankly treated so poorly and censored. And, it was so many ad hominem attacks. It was disgusting. And yet you carried forward with the courage and conviction that the truth mattered to your fellow citizens and their health. And for me, this is really quite a significant time in our history where the question becomes, dare we get engaged as citizens and speak up and renew our country to allow civilization to continue in some measure? I know this sounds incredibly, histrionic or dramatic, but that's not overstating it, is it, Jay?
No, I think that the way I think it is, our republics are really at stake here. Right? If you don't have free speech, you don't have a free republic. You don't have a free people. It is the core civil right. And a country, a government that decides that it will abrogate those rights is no longer a democracy. It's no longer a republic. It is something else entirely. It's an authoritarian power that stands over us. I don't think that is overstating the case. I don't recognize the American Republic if it doesn't have free speech at its core. It is really truly at risk at this point. We didn't have free speech during the pandemic. Mm-hmm. And the question is, will that power, now that governments have used it and deployed it at scale, continue to be allowed to be used at scale? I hope we win the Missouri versus Biden case. But, I look around the world and I see, for instance, Ireland passing a law.
Indeed.
That abrogates free speech rights for people online in the name of safety. The free world is headed backwards.
I agree. And in fact, one of the things that we did want to show within this discussion, Jay, was a clip from Michael Schellenberger talking a little bit about the case of Ireland. And he does show that here.
It sounds like a Black Mirror episode. The police can enter your home unannounced, search your phone and computers, and arrest you for the things that you're reading, watching, or posting online. If you refuse, you could be sentenced to 12 months in prison. But it's not a Black Mirror episode. It's worse than that. It's real life. At this very moment, the government of Ireland is trying to pass a law before Christmas that will let the police go into people's homes and confiscate their phones and computers. Now, you might think Ireland doesn't matter, that it could disappear tomorrow without much impact. But Ireland does matter. It's the test case for the next phase of the global crackdown by military and intelligence forces and their agents that's been happening over the last 7 years. What they used to call a conspiracy theory has now been confirmed as true. Our research has exposed a far-reaching plan by military and intelligence agencies in the United States, Britain, and other nations to subvert the democratic process and engage in activities that have a basis in military techniques and which are tantamount to attempts at thought control. This isn't about censoring the far right. This is about censoring independent journalism. And if you're in Ireland, this is about censoring you. One understandable response to all this is to ignore it and hope it goes away, or wish that it won't affect you. And maybe it won't, but our ancestors fought and died for the right to speak our truths, particularly about controversial cultural and political issues. And already we're fighting back and making progress. The Irish government was forced to back off this law once already, and we can make them back off again. Free thinkers in the United States and around the world must stand up now for Ireland. We have to fight the totalitarians over there so that we don't have to fight them over here. We need to send a message to the politicians and the police that the world stands with the people of Ireland and their first and fundamental right. Please share this message and consider donating to a special free speech fund at censorshipindustrialcomplex.org. If we don't act now, our children and grandchildren will look back at this moment and ask why we didn't do more while we still had a chance. So please get involved now and stop this Black Mirror episode from becoming real life.
So one of the questions I have for you is that this whole policy debate and discussion seems to be linked to not only the suppression of information, the censorship in so many areas at a national level. It's connected in a peculiar way to international bodies that seem to be working across every international jurisdiction. And we know the parties well, the World Health Organization for starters, and there's so many of them. But it seems to me that this is a kind of a particular international initiative that is kind of sidestepping democratic structures and the ability for people to have a voice in any decision making. How is this interrelated from your perspective? I mean, it's interesting. We met some, 2 years ago in London, England, really on a conference related to this, trying to figure out what was really going on here. But there were particular relationships being made among all these parties, among the usual suspects. It wasn't just the Gates Foundation. It wasn't just simply the Rockefeller Foundation. There were so many others that were almost working together as a team to advance this kind of thinking that has led us to where we are.
I mean, I some of that stuff is above my pay grade, David. So let me just focus on the things I do know for certain, right? So let's just talk about the World Health Organization. And the right now what's happening is the World Health Organization is in the midst of writing a new pandemic treaty.
Indeed, yes.
That will greatly expand the set of powers that the World Health Organization will have to compel action by signatories in the context of another pandemic. That those powers, I mean, if the treaty is not yet written, it'll be written. I think it's supposed to be spring of next year will be done, and then hopefully there'll be vigorous discussion about whether countries like Canada and the U.S. within them whether we should sign them. But in effect, what that does is if the U.S. and Canada, whatever country signs that treaty, it will allow Canada, the World Health Organization, to abrogate basic civil rights in the name of pandemic management. That's the basic upshot, right? Not like if you read the kind of propaganda around it, the World Health Organization will say, well, there's no formal power. We're not going to, obviously we're going to rely on cooperation. But we've seen the playbook during the pandemic.
Indeed.
When you have the public health authorities ring the bell, a panic bell. People panic all over the world, and they're very, very willing to give up basic civil liberties
Hmm.
in the name of promise of security from a pathogen. That's a tremendous power, even if it's not formal. And the World Health Organization's pandemic treaty makes it easier for them to ring that panic bell, to go into countries and that are the recalcitrant. The premise is that if we don't all act together as one world when a pathogen happens, we won't be able to control it. Well, we've seen the problem, right? It's when you have a pathogen that's spreading wildly, even concerted action by governments is not capable of control. It's an illusion of control
Hmm.
that doesn't exist. I do think, I think it's not unreasonable to want to have countries report, if they find a new pathogen, report to the world quickly. I mean, that's not an unreasonable thing. But this pandemic treaty, if I understand the direction it's headed, goes far beyond that. Um, and I think, the second question I have is a question of trust. The
Indeed.
World Health
Yeah.
Organization tremendously failed during the pandemic. Is this the kind of organization that you want to have that kind of expansive power, given the way that it deployed uh, less power during the pandemic to cause panic around the world and to cause bad policies like lockdowns to spread everywhere?
Indeed. To be clear, how can one have active, engaged public healthcare policy if you don't have a measure of trust with decision makers? It doesn't work.
No, that's the key piece. I mean, it's not like a military thing where what matters how many missiles you
Hmm.
have. Trust is the most important, uh, uh, the most important asset that any public health agency has. Um, the public health agencies of the world have essentially dissipated the trust that the public once had in them. Vast numbers of people no longer believe the utterances of public health authorities because they abused that trust during the pandemic. The World Health Organization, in particular, I think, bears a tremendous role, a negative role in that. And they come asking for more power. Essentially, I guess the argument is they failed because they didn't have sufficient power last time. Well, they didn't use the power that they had last time in a trustworthy way.
Hmm.
Just going back to the Great Barrington Declaration, right after we wrote the Great Barrington Declaration, the World Health Organization changed its definition of herd immunity to exclude infection-acquired immunity,
Yeah.
something that the ancient Athenians knew about. It
No,
was like
exactly.
basic scientific facts. They were using their power essentially to push forward a false epidemiological message in service of vaccine companies. Well, it's an abuse of trust. I mean, abuse of power, abuse of trust. I mean, so I think that the World Health Organization needs to go back to the drawing board. If it wants more power, it first needs to have much more effective, uh, uh, much effective support for civil rights, basic civil rights. They should make a commitment to never to recommend the violation of civil rights ever again, as they did during the pandemic, and then make that concrete. And then second, they need to have less corporate control. Like, the World Health Organization, a very large chunk of it is funded by the Gates Foundation. Why do we have one private philanthropy have so much power
Hmm.
over a international organization like that? That's entirely inappropriate. It needs to divest itself of that kind of corporate power uh, at its center. And then third, it needs to respect the autonomy of countries much more than it currently does. I think even with all those three, it needs to fundamentally transform its scientific advice that it gets, so that it doesn't have sort of this monolithic advice by a small cabal of scientists who push a narrative. They need to have much more broader set of scientific voices at the core. Those at the very least would be necessary before I start to trust the World Health Organization again.
Well said. I like your vision, Jay, for frankly renewing not just simply public health, but science. And I know we've talked with Dr. Martin Kulldorff about this as well. We need to decentralize a lot of the funding, the decision making, the power, so that we engender vigorous scientific debate. You can't go wrong with those foundational principles, and certainly those are very important to stick up for. So bravo on you. So as we look to the future, we have a lot of major revelations and things to look forward to in 2024. And one of the signs of hope I have is certainly the actions of citizens. I think of the National Citizens Inquiry in Canada and their incredible work across the country. And I think of course, the truckers' convoy who were, as Dr. Martin Kulldorff said, they were following the science in their cabs as they listened to all kinds of things on their way to Ottawa to kind of raise the flag literally for common sense. Where do you see the signs of hope, and how do you think citizens can play a greater role in bringing sanity back to our world in public health?
So first of all, both of those entities, the National Inquiry that in the UK, in Canada, and the truckers are heroes to me. I mean, they have done yeoman's work that governments ought to have been doing. The truckers in particular, they really transformed the policy. The policy, especially in Canada, was discriminatory and anti-scientific. They were essentially marginalizing the lives of anyone who decided not to get the vaccine in ways that had nothing to do with the efficacy of the vaccines. It was just pure, raw discriminatory power. And the Canadian truckers, by their very effective protest, put an end to that. And to me, they're like tremendous heroes. The citizen inquiry is also a model of how these inquiries ought to be run. You can see the opposite. Like, for instance, in the UK, they're running an inquiry where it's incredibly one-sided. They come with the premise that, oh, well, we should have locked down earlier. Had we locked down earlier, everything would have been fine. And then with that lens, talking to every single person who made tremendous mistakes during the pandemic, but not in the direction they're suggesting. Mm-hmm. They're continuing to have this one voice, which got basically everything wrong at the center of their inquiry, whereas the National Citizens Inquiry in Canada is quite the opposite. They have quite a diverse set of voices giving their testimony, and as a result, the end product is much more sensible. So I think that those are certainly fantastic areas of hope. I do think that it will be more difficult. I think many people now, looking around, almost 4 years on, realize that the pandemic policies we follow were tremendous failures. They look at the damage to their kids, to kids' psyches. They look at the vast inflation that are happening, the budgetary impacts, the economic impacts. We're kind of waking up with the hangover of the excesses of the last 3 years, 3.5 plus years. And I think that to me is a source of hope. I don't think that people really want to entrust the kinds of entities that made those decisions with the same kind of power again, now that they're starting to understand what a catastrophic mistake that they had made to begin with.
Well said. Well, thank you so much, Dr. Jay Bhattacharya, for joining us. And I certainly wish you and your family and your colleagues every success as we get into 2024. And we're grateful that we could have this discussion. And thank you for your courage and your leadership.
Thank you, David. It's so great to talk with you as always.
Thank you.
Thank you for watching Leaders on the Frontier. We're a nonpartisan think tank. We explore ideas, policy, and practical solutions that can make a difference in the lives of Canadians. We do not accept any government funding. We work for you. Thank you for supporting Frontier. Visit fcpp.org to give. While you're there, be sure to check out our latest articles and research. Without open discussion and debate, you're not thinking, nor are you free. Comment below. We'd love for you to join the conversation.